As an introduction for our next speaker, who's also a very brave woman who's faced this disease, I want to give you a little introduction by talking about Hispanic women. We talked about, African American women suffering disproportionately from the disease. Hispanic women suffer in a different way. Although Hispanic women get breast cancer slightly less often than do white women or African American women, it turns out that Hispanic women, we know, get screened less often. So getting the message out to this community is very important. The other problem is that Hispanic women are diagnosed at a higher stage of disease. So they come to our attention at a time it's much more difficult to cure them. So this year, one of the initiatives we have was reaching out to women who are in minority groups so we could increase the awareness, the long-term awareness, and provide this service. So I'd like to introduce Lori Mercedes, who's going to come up next and tell us her story.
Good morning, everyone. My story started a little bit different. In 2008, my first child was 7 months old, and I felt a lump in my breast. And being, the Latina woman that I am, I kind of knew this is unusual, but then again, I just had a child, so it felt like a lump, a gland, but I didn't know quite right what it was. So I went and I saw professional help. I went and I saw one of the older ladies that we call in our community curanderas, and I said, I have this lump, can you check it out? This lady is like 72 years old. In our community, people come to people like her for advice and divorce, custody, anything that has to do with health. So she felt the lump and she said, you know what, don't worry about it, you just had a child. So it's probably one of those milk glands that it's inflamed. So I still was not quite convinced with that diagnosis, so I went and I saw a second opinion. I went to see the lady that was kind of like similar than what she did on the south side of the city. She felt the lump and she said, do not worry about it, it's probably nothing. And besides, Hispanic women don't get cancer. And I thought, okay. So there was something about it that I still was not feeling quite right about it. So I went and I saw my doctor, my gynecologist. Him and I, we had a good relationship because I go see him every month and I usually have all kinds of questions. And what I loved about the relationship that we have, that he had never dismissed any of my questions saying, you're silly, you're crazy, you're making things up. So he always gave me that time of the day to kind of address my issues. So I went in there, and as soon as he felt the lump, he looked at me and he said, you have an appointment on Wednesday, and I want you to have a mammogram, and on Friday you're going to see a surgeon. And I thought, okay, this is not good, but I'm not going to panic. Hispanic women don't get cancer. I called my mom and I said, this is what happened, this is what they say. My mom said, do not worry about it, don't panic. We don't have any cancer history in our family. And I thought, you know what, she's right. We don't have cancer history in our family. Went to see the mammogram, and it's funny how you go and they do the study and everything, and there's only one person that is taking care of you. They go into a little room, they analyze the results, and then 5 people come into the room, and they're all looking at you, but they can't say what it is. It's a 50-50%, and I'm like, do I have it? We can't say that. By the looks of it, I know something is not right. I go on Friday to see my surgeon, and my surgeon says, there is something abnormal there, that we don't know what it is, and we're just going to remove it because it has no business being in there. So I thought, okay. So we had the surgery the following Tuesday. He said after the surgery, it's going to take me probably 2-3 days to get the results. So we'll call you and let you know. I got the results the same day by 3 o'clock, and I remember it like it was yesterday. He called my house and he said, is your husband at home? And I said, why? You need to speak with my husband. And he said, is he home? I need to talk to him. I got the results. And then I said, no, you're going to talk to me. He said, please put your husband on the phone. So I put my husband on the phone. And before I handed him the phone, he said, Lori, it is cancer. And I don't quite remember what happened, for the next hour or so. All I know is that I just felt like somebody punched me in my stomach. And I just thought, I just had my baby. Why now? So needless to say, I was, in a week, I was back at the surgeon's office. And this time there was a group of people with me. My family had flown in, my parents, my sisters, and then there was all kinds of members of the Hispanic community. So there was 30 people waiting in the waiting room of the surgeon. He came out, he looked at the receptionist and he said, I thought this was my last appointment. And she's like, yeah, they're with her. And he said, okay, let's clear the conference room. And we had 30 people in that conference room. There were people with cell phones and they were actually contacting their sons in New York, California, that they were surgeons, and everybody had questions. And I remember being in a little corner, and everybody was talking about what was happening to me. But I was in a little corner, and I just didn't want to deal with it. It was just too scary, and I just did not want to let people know that I was scared, that I was terrified. My younger sister took over, and she started asking the questions. What are we going to do? What's the next step? We had neck surgery. They found out that my lymph nodes were not compromised. Then we had a kind of attack. Within 2 weeks, I was going to start chemo and radiation. We did that. We did the Herceptin. Before that, my doctor had a conversation with me and said, you only have a child. Do you want to freeze your eggs and have them just in case you decide to have a second child? And I said, no. God has been graceful enough to give me one child, and that's all I'm going to ask for. I'm okay. I just need to live now. I need to live for this child. So we went into the whole treatment thing and everything, and the whole time, I remember my oncologist having the conversation with me and saying, look, this is the deal. I know you're terrified. I am going to go ahead and take care of the curing piece, even though I'm going to kill you in the process, because what I'm going to be injecting with this chemo is poison. You need to keep your morale up. I need your immune system up. You need to keep thinking positive. This fight is won mentally, and I need you to put everything that you have in you to help me. And I said, okay, we got a deal. Needless to say, next summer is going to be 5 years. 5 months ago, I just gave birth to my second daughter. So it is important. It is important, and it's out there. And this myth, I forgot to tell you that I did go back to those 2 ladies and I said, guess what, I got cancer. So in the summer of 2008, there was a panic wave in the Hispanic community because all the women goes to these 2 ladies and everybody thought that they had cancer, breast cancer. So the one thing that I remember the most is when I was waiting in the locker room for my radiology appointment, the one thing that I remember was that there was a lot of strong women there. The one thing that I remember that there were people that they were facing worse things than I was. I was able to detect it on time. And I feel like it is our responsibility to be able to tell other people, you know what, even if you haven't had it in your family, get it checked. It is important, and it is our responsibility as women. So, thank you.